We have seen an uptick across the country in diagnostic labs in the percentage of Histophilus somnus that is identified as a pathogen when a pathogen is identified in a necropsy and or surveillance samples on cattle on arrival in feed yards, in dairies, and in cow-calf operations. And we're seeing more and more of the prevalence of Histophilus, and then on top of that, its involvement in causing BRD in cattle. It's different than Pasteurella and Mannheimia in how it usually affects the animal. We see all different kinds of symptomology with Histophilus, from heart lesions to pleuritis a lot of times around the lungs, to overt BRD that we diagnose that's caused by Histophilus. We're seeing it more and more as a primary respiratory pathogen. Prevalence is the most powerful PK/PD, pharmacokinetics and dynamics against Histophilus somnus on the market. It is a long-acting macrolide, easy to dose with 1 cc per 100, sub-Q dosage. The features of the drug are 28 days above MIC for Pasteurella and Mannheimia, and 14 days above MIC for Histophilus somnus, for the treatment and control of bovine respiratory disease. Cattle are expensive, period. The old philosophy of first time we pull an animal and let's give him something and see if it's going to work, and then make a decision down the road if it doesn't, and really that's what it comes down to. Our labor force in feed yards and stockers and in the cattle industry in general are overtaxed, and so anything we can do to help them by given drugs like Prevalence when we pull these cattle, it becomes an important part of their operations. We know that animals that get back to health quicker perform better. They do better in the feed yard. Numerous studies have been done that show that there's a big difference between an animal that we get treated right the first time versus one that has to be treated another time. If we can make our protocols be effective on bovine respiratory disease from the initial pull, we know that those animals will perform better. We offer powerful products like Prevalence to get the job done right the first time.